Shemai, I'm Tracy Cooper, Chief Executive of Public Health Wales.
And hi everyone, I'm Tracy Daskovich, Executive Director of Public Health for the Aneurin Bevan University Health Board. We are the co-chairs of the Prevention and Population Health Management Strategic Shift of the Communities by Design programme.
We're here to talk to you about Community by Design. So Community by Design aims to help us create a healthier Wales and a health and care system that better meets the needs of people and communities across Wales. Within this transformational shift, we've been exploring how we address a specific challenge facing our system. That is how we can take a prevention-first approach and embed prevention and population health management as core business across the healthcare system in Wales, in order to improve the outcomes of our population and reduce the inequalities that exist. Wales faces increasing demand associated with an ageing population, rising levels of multiple long-term conditions, widening inequalities, and persistent variation in outcomes. While healthcare services have achieved significant advances in diagnosis and treatment, too much of our system remains focused on responding to illness after it has developed, rather than preventing illness, deterioration, and avoidable demand. Large numbers of our people continue to live with preventable illness and modifiable risk factors. At the same time, health outcomes remain strongly influenced by socio-economic circumstances, geography, and the wider determinants of health. These challenges can't be addressed solely by improvement treatment pathways. They require a systematic approach to embedding prevention through our planning, commissioning, service delivery, workforce development, and performance management across the NHS in Wales.
Historically, prevention has often been delivered through programmes, initiatives, or specialist services operating alongside mainstream healthcare delivery. Whilst these approaches have delivered important benefits, they have not been sufficient to create a prevention-orientated healthcare system. For prevention to have population-level impact, it must move beyond individual projects and become part of the way healthcare is routinely organised and delivered. Prevention must influence how services are planned, how resources are allocated, how pathways are designed, and how staff are trained and how success is measured. Every patient contact, every pathway, and every organisation within NHS Wales has the opportunity to contribute to improving people's health, identifying risk earlier, reducing inequalities, and preventing avoidable deterioration. Making prevention core business therefore requires a whole system approach supported by clear standards, population health intelligence, workforce capability, evidence-based interventions, and accountability for outcomes. The challenge facing Wales is not whether prevention is important. The challenge is how prevention becomes the normal way healthcare is planned, delivered, and measured. We hope that the national model for prevention that we have developed with our partners enables us to achieve this.
The suggested approach to embed prevention across the healthcare system in Wales and the different components in it is summarised in this diagram. It represents our current thinking based on the work we've done so far and is not a finished solution yet. We're now moving into a phase where we want to test and strengthen the suggested approach through wider engagement and to hear your views on it. The proposed approach combines community-led approaches with nationally consistent once for Wales expectations and local flexibility through subsidiarity, allowing decisions and interventions to be delivered at the lowest effective level closest to our communities. The components of the model include national prevention standards, which will define the measurable expectations, behaviours and system features that ensure prevention is delivered consistently, equitably and effectively across Wales. System design, which provides the blueprint for how prevention is systematically embedded across the life course, care pathways and organisational levels of NHS Wales. Prevention-based healthcare delivery, which guides how high-quality prevention activity is delivered. Population health management, which uses linked data, segmentation and risk stratification, providing intelligence and insights to drive proactive action, identifying priority populations and enabling interventions before deterioration occurs. An outcomes framework which aligns planning, performance and accountability around improvements in health outcomes, healthy life expectancy, equity and sustainability, reducing inequalities and creating sustainable services. and a workforce component, which builds the knowledge, skills, behaviours and culture required to make prevention and populational health management routine practice in every role and every contact to deliver community by design. Together, these components create a prevention-focused system in which decisions are driven by population need rather than organisational structures or service activity.
At its heart, the approach has been designed to improve healthy life expectancy, reduce the burden of long-term conditions, narrow inequalities, and make healthcare sustainable. It supports a culture where every interaction is an opportunity for prevention. Every organisation contributes to population health improvement, and citizens and communities are empowered to play an active role in their own health and well-being. Through aligned architecture, standards, workforce capability, data, outcomes, and local leadership, the model creates a coherent prevention system capable of delivering better health outcomes for the people of Wales. We would now like your feedback on this emerging model. We're particularly interested in what feels strong and credible, and what would enable it to work in practice, and whether there is anything important we have not yet considered. Please reflect on these three questions. What elements of the model are particularly strong? What will help enable the model to work in practice? And is there anything important that is missing or needs further consideration? We are now inviting feedback to help us strengthen our approach. We want to better understand the implementation challenges and ensure that our suggested approach is practical, credible, and most importantly, deliverable. Please share your thoughts by completing the linked Microsoft form on the engagement portal. And thank you for taking the time to contribute. We look forward to hearing from you. Diolch.